Welcome to the Research Collective, your podcast for the latest public health research and insights on today's most pressing public health challenges. On today's episode of the Research Collective, join us as we discuss the role of doulas in childbirth with a very special guest speaker, Chanel Jones. Hi, everyone. Welcome back to the Research Collective, your go-to podcast where we break down and discuss public health topics that matter in real life. I'm your host, Deepali, and I'm joined today by our other TRC members, Bipin, Asha, and Aparajita, and a very special guest. Today's episode is one that really hits home for many of us. We're talking about maternal and child health with a special focus on childbirth and birthing outcomes. And to help us dig deeper into this important conversation, we have with us on the show today our guest speaker, Chanel Jones, a certified doula and proud mother who brings both professional knowledge and personal experience to the table. Chanel grew up in Oklahoma and worked in the U.S. military as an emergency manager before settling back down in Texas. She's currently pursuing her Master's of Public Health in Health Promotion and Health Education with a specialization in maternal and child health. And Chanel will be graduating soon. Chanel is also a certified doula and the founder of her startup, The Encouraging Doula. So Chanel, welcome to the show. We are thrilled to have you here with us this morning.
Thanks so much for having me, Deepali. I'm excited to be here and talk about a topic that's so close to my heart.
All right. So many of you may be wondering what exactly we mean by maternal and child health. Well, maternal child health is a very important aspect of public health that focuses on the well-being and the health of women during pregnancy, childbirth, and the postpartum period, as well as the health of their children. So that means it includes everything from prenatal care, safe delivery, breastfeeding support, and early childhood development. Now, unfortunately, the United States has one of the highest maternal mortality rates among high-income countries. And these disparities are especially alarming when we look at differences by race and income. So, for instance, Black women in the US are 3 times more likely to die from pregnancy-related causes compared to white women. And yet, access to care still isn't equal across the board. And so that brings us to our conversation about prenatal care, birth support, and postpartum care, and why it's so important. So, with this as a background, Chanel, I'd love to start with you. What led you to specializing in maternal child health?
So honestly, it started with my own birth story, but before then, the doula part came into play when I watched the documentary about the importance of doulas called The Business of Being Born. And so from then, that documentary, I knew that I wanted to have a doula when I gave birth. And so that's what I did. But on top of that, when I started to understand that a lot of times doulas help because you don't always feel fully heard or supported during the process, it left me wondering how many other birthing people feel the same because I had a doula and I know what the benefits of that was. So how many other people didn't get to have the experience I had? So that lit a fire in me and I knew I wanted to help others feel empowered, safe, and control in their birth journey. And that's what brought me to doula work.
That is very interesting. And I always love when there's a personal angle to it, a personal motivation. So thank you for sharing. Now, let's talk about your journey to becoming a doula. And very quickly, for our listeners who may not be familiar with what a doula is, could you walk us through what exactly a doula does and how that is different from, say, what a doctor does or a nurse does?
Absolutely. So a doula is a non-medical professional. The word is derived from the Greek origin, which means like a servant. And so doulas offer support in ways that you don't always see being, shown in like the hospital. So we can offer physical support, emotional support, and mental support. But we don't offer just to the mother. It's offered to the whole community of that birthing mother, father, or the family as a whole. If there's children already there, so the doulas can offered in various ways. We're like a birth coach, an advocate, and we can be a common presence. So, the research backs up birthing people who have doulas are less likely to have C-sections, and they're more likely to have shorter labors, and typically report higher satisfaction with their birth experience. I know at least I do.
That is incredible. And I love that doulas take a holistic approach to, it's not just maternal health, but just looking at family support, being there for everybody during this very stressful time. So I really think that's incredible. I'm curious, do you have a story, maybe an anonymized one, that really captures the difference you've seen that a doula makes? I know you said you had a doula for your childbirth experience, so we'd love to hear more about that.
Well, I will say that the biggest benefit for me with a doula was my doula recognized my emotional health was lacking. And she didn't say it so candidly, but she suggested that I take a class that focused more about the mental aspect of childbirth, which I think really gets overlooked. We think of it as a physical experience, but like you said, it's holistic. And that class, I believe, afforded me to have the birth that I envisioned, because it was about breaking down the barriers in our mind, the mental roadblocks that was keeping us from really getting to the intended goal. And I don't know that I would have had the experience I had just in that aspect of having a doula, along with everything else. I had one of the shortest births that first time mothers have. The expectation is that a mother would have a baby at the minimum within 12 hours. I had my child within 9 hours from the first contraction to her being out in the water unmedicated. So I was just so thankful for the experience.
That's amazing, Chanel. Thank you for sharing about your own journey. And I was actually really curious for people that were interested in becoming doulas, where do you recommend they go to find more information? And is there like a specific process to becoming a doula?
So it's tricky because doulas aren't mainstream. So basically, they're more regional in terms of the training you can get. The United States doesn't have a standardization of how doulas are certified, but there is a certification. DONA International is the #1 premier doula organization, and then there's one called CAPA. But if you look within your local community, you will find more than likely doula organizations that are probably startups where they're like a master certifier as a doula, and she could train you. And then you would do the course that they have, and then you would need to have so many births to certify, like on the job training. So I would recommend, honestly, if that's something you're interested in, to look locally, like Google the doula organizations in your area and connect that way. And it could be just start with Google. A lot of times they'll have an Instagram presence or a Facebook presence, and you can learn a lot more about their process.
Yeah, no, that's awesome. Thank you for sharing. And we'll definitely have to link those websites. I know you said like some of the more like international doula organizations that people can look to if they're curious to learn in becoming a doula. So thank you.
Yeah, that was really interesting. We don't have a doula certification for the United States. I'm curious, Chanel, are doulas an international role, or are they specific to only certain countries? Because I don't think I've heard of them in India, but I feel like we would benefit so much from, say, having that additional emotional and mental support during childbirth.
That's a really good question, Deepali. And I only learned this in our last course that we had. Yes, actually, they are international, but it's still country specific. So sometimes it could be tied into the maternal care of that country. For example, France has a doula organization for the country. So they have actually a standardized process to become a doula there. So a lot of times it's interwoven into the way that culture or country already handles maternal care. And so there's various countries that do have doulas, but not all, as you noted.
It's always good to know, outside of the US, how are things perceived and how things work, but that's incredible information. Okay, so let's move the conversation back to the United States and talk about the reality that is often brushed under the carpet: maternal health disparities, structural racism, lack of access to care, and implicit bias in healthcare settings that are all part of the conversation about maternal child health and birthing outcomes. So, Chanel, what role do doulas play when it comes to advocating for patients, especially in clinics or hospitals or medical settings?
Although we're not medical professionals, part of the certifying and the coursework is understanding how birth and labor works. You know, anatomy, the different phases of birth. So we have a deeper understanding of how birth looks and how it's supposed to go. So with that in mind, we can then advocate from a place of understanding when we see maybe something that the mom or the father is not aware of. For example, with my own personal birth, when it was time for me to transition to the water, I didn't know the changes that my body was displaying that I was transitioning to the last part of stage of birth. And because my doula had done so many births, she was able to then say to the midwife in language the midwife understands that, hey, I think we need to take another look. So I don't know what would have happened if she wasn't there. So that's one way a doula can advocate. Another way a doula can advocate for patients, especially in hospital settings, when you're in the process of giving birth, you may have forgotten all the rules you wanted, your birth plan, and the doula is there to remind you, to say, hey, remember we talked about this? Is this something to kind of reinforce the things that may have gone out the window because of the hustle and bustle of being in the midst and thick of it? So that's a couple of ways doulas do that.
That's very neat. And I think that leans more towards almost like culturally competent care for women going through childbirth or leading up to childbirth. I know Aparajita had a question on this topic.
I did. So, yeah, I think the concept of culturally competent care is really important. What are your thoughts on utilization across racial and ethnic groups?
We've seen an uptick of doulas, especially in my community, probably since the pandemic. Because as you know, babies didn't stop coming because we had a pandemic. But I believe that as, at least in the African American culture, there became this, awakening to this health disparity and the results of it, this high mortality rate, that women have started, and it's not just women, there's actually a dad's doula coalition, I think based out of St. Louis, that they're even starting to see the significance of stepping up because we need to do something. So I am seeing a huge jump in the African American community. And I want to also say that for a while, doulas, which kind of had its start in New York City, was seen as a luxury. I think people starting to understand it may be a necessity now.
Wow. Thank you. It's good to know. And hopefully it becomes more of a widely used thing across groups, because it seems so beneficial both mentally and physically.
Absolutely.
I agree. And I think I really like that the dads are also getting involved in it, because quite often when it comes to women's health or reproductive health, women tend to have to go at it alone. So it's really encouraging that we're getting more and more dads and partners involved in the doula process and really looking out for the mothers. It's very encouraging. And so, Chanel, this has been super interesting, very powerful insights on the role of doulas, but we know it's not always easy doing this work. So what are some of the biggest challenges that doulas face today?
That's a really important question. One of the major challenges is recognition and integration. Doulas aren't always respected or welcomed by some healthcare providers, because even though we're there to support and not interfere, there can be misunderstandings about the role. I mean, we're non-medical, so if you don't understand what we do, you may not find the value in it. There's the issue of insurance. As you know, in the United States, we don't have, a national healthcare system. So each state has different rules for what's covered. And so some states are covering doula services. So a lot of times people can't afford the out-of-pocket expense for a doula. So even that, the importance and the value not being placed on the healthcare sector affects who can have accessibility to the doulas. And then lastly, I would think the not having a standardization of what is required to become a doula leaves it where someone may take, like for myself, I want to be beyond certified. So any courses that I can take to make me more equipped and make me a better doula, then I can do that. But then someone may just do the bare minimum. Not saying that's wrong. However, their level of expertise will vary and there's no standardization. So I think that needs to be looked at also.
Yeah, that's interesting. And that kind of leads to my question about, as a doula, what you think would be the next steps for people in the US to move towards standard that all doulas adhere to, making sure if I have a doula for my childbirth, that I'm able to fully trust them, that they're well equipped. So what steps could we take to move towards a situation where all doulas are fully equipped?
That's a good question. I believe that there should be at least a minimum of continued education after the certification, even if you just did the basic certification, especially if you haven't done a lot of births. A lot of people get into doula work as part-time work. Not many are doing full-time. And so you may not do so many births. So I think if not, there definitely needs to be continued education. Now, if you're doing 10 births a year, you may not need that continued education. But I think that at a minimum, there should be either or. You're either actively working in it, so you're staying fresh on your skills and your knowledge. And if not, then we need this continued education.
I agree. All right. Well, that was a very interesting discussion on the role of doulas and challenges around being a doula in the United States. And so let's move to a little more fun and fast-paced round of myth or fact. So, Chanel, we will read out a statement about a commonly held belief and ask you if it's a myth or a fact. And you're welcome to give us a little explanation to back up your perspective. So, are you ready?
I'm ready. Let's do it.
All right, the first statement is doulas deliver babies.
Myth. That's a job for doctors and midwives. However, there is a possibility if you're in a situation that the doula is the only person there that we could possibly deliver the baby.
Awesome. I love that. The next stage is you can only have a doula if you're doing a home birth.
Total myth. Doula support births in hospitals, birth centers, and homes. Yes.
All right, the next one is having a doula can reduce labor time.
That's a fact. Research shows having doulas can lead to shorter labors and fewer complications.
And the last one, doulas only support the birthing person.
Myth again, we support partners too to make sure they're informed and involved. And there's such thing as postpartum doulas that will come and do maybe your laundry or hold the baby while you and dad sleep, may make meals for the family. So there's a plethora of ways doulas can support the whole family.
I really love that. I think like it's at any time extra support is so helpful, but especially, before, during, and after childbirth, I think that support can be instrumental, especially for a lot of people who don't have family that they can rely on. So, Chanel, before we close out this episode, what is one big thing you would like our listeners and soon to be parents to take away from our discussion today?
You have choices. You deserve to be heard, respected, and supported every step of the way. And do yourself a favor if you can and gift yourself a doula.
Well, we've heard it from the doula herself. So thank you, Chanel, for joining us today and for all the important work that you do in the maternal child health space. And we look forward to having you on future episodes of the podcast to talk about it more. For our listeners, if you'd like to learn more about doulas and childbirth or connect with Chanel, we'll be dropping this information and some helpful resources in the comments below. And so if you found this episode interesting and helpful, share it with a parent or soon-to-be parent in your life. Thank you for tuning in to the Research Collective today, and we will see you next time.
If you enjoyed today's episode, be sure to drop a like or comment below, follow us on Instagram, YouTube, and Spotify, and share it with a friend.